We will have some time for questions at the end, and the recording will be posted on our website as usual. Yoni, you can begin.
Good afternoon, everybody, or for those on the East Coast or the West Coast of America, good morning. So my name is Yoni Aizer. I'll tell you a little bit about myself. Background educationally is a mix of business and finance. So undergraduate, a graduate degree, MBA from UCLA, also business with finance. I had a background in supply chain management before grad school. And then coming out of grad school at UCLA, I got into what's known as healthcare supply chain. So healthcare supply chain, we think about it in a different way from like automobiles, Tesla, or different industrial companies like GE, or even like Teva, where it's a mix of manufacturing and sourcing raw ingredients and supply chain channels. For the most part, hospital supply chain is focused on two things. So one is just commercializing, taking ideas from the market and bringing them into the hospital with contracts and implementation strategies and alignment from a clinical perspective and alignment from a business perspective. And the other thing that hospital healthcare people do is plan a lot of cost savings because all the money we're spending with the organization and designing the organization is really just an expense management. And if you think about the profile of most hospitals, at least in the United States, for every dollar we bring in revenue, about 40% to 45% of that dollar is spent with another company. Most of the expenses are on employee salaries, but there's a lot of financial dependencies on companies. So it's a very unique role. It's a big ecosystem to manage, anywhere from office supplies to complex medical device and complex medical equipment. And of course, increasingly with software applications and AI. So that's typically what we do here. So I was invited by MedTech Commercialization Institute to come and educate and provide some content that I hope you all find helpful to me. So it's a little bit about me and certainly happy to get into these topics. Plan for about 25, 30 minutes today to get into these topics and then save about 15 to 20 minutes for questions because I think in net, my goal here is to give you the content that you need, the information you need, but I think the best learning is going to come from the questions. So I don't want anybody to be shy with asking. So this is a high level, what we call a cursory view, how healthcare works, at least in the United States, right? So the problem space is this. There's a lot of cost pressure in healthcare. I think those of you who have ever lived in the United States know that the market here and the ecosystem here is very different than we have in Israel. So in Israel, I think about the net numbers, about 10% of GDP is spent on healthcare. It's mostly because it's government administered, the margins are different, the budgetary theories are very different. Here in the United States, it's about 18 to 19% of GDP. So it's a tremendous number. Now, I think in the political landscape, they often call the for-profit model versus the government-managed models the cause of this. I have a very, very different perspective. I think it's much more about the free market system here, where we have spending that can go up, spending that can go down based on the market requirements. It's a little bit of a different mechanism of what you see in Israel, what you see in Europe. But regardless, in net, this is the opportunity here. So United States healthcare spending at $5.3 trillion dollars, it's a tremendous number. I think everybody should really pause and think about what that really means. You think about this globally, the United States healthcare GDP, I think would be today the fourth largest GDP in the world. So there's a lot of opportunity. There's a lot of ways to think about it. I think traditionally investors, founders, private equity think about a very different perspective in terms of how to add value. But here, this conversation today will help you think about things a little bit differently and then help you plan out your solutions and commercial strategies a little bit different. So if you think about this from a net perspective, US healthcare spending in 2015 was only 3.2 trillion. Granted, our economy and our GDP has grown tremendously in the last 10, 11 years, so that partially explains why the growth is. But you think about the net spending on a percentage basis, it's far outpaced anything else in terms of our GDP. Some of this reflects demand, some of this reflects international care, some of this reflects an aging population in the United States. On a percentage basis, you have more people aging than you do have in the younger generations. So what we call demographic change. But in net, a lot of the market factors have pushed healthcare spending up and in that direction. So there's a lot of reasons for this. So the simplest answer is this: it's very labor intensive. And that labor has a lot of market power over the providers, and the providers have a lot of market power over the payers, be it the private payers, the government payers. And then in net, at the end of it, there's a lot of employer plans. I'm sure you've heard of United. I'm sure you've heard of Cigna, Blue Cross Blue Shield. There's a mixed market dynamic of hospitals, payers, employers. And that's what really causes a lot of this sort of bloating. And it's also what causes a lot of this fragmentation. So the fragmentation, I don't think is the tremendous opportunity because there's so many different coordinated parts that need to move. But I think if you think about this larger ecosystem in parts, you'll start to see what healthcare really looks like here. So we talked about complexity. There's a lot of complexity in terms of the delivery model and the ecosystem that everything involves in. But I think within the hospitals, you're also going to see a lot of complexity. My background, quite honestly, is with hospitals and with a lot of the companies that support the hospitals. I'm not as familiar with the payers, the private payers, or the commercial payers, or the government payers, but I understand the net dynamics to be a little bit effective there. My goal for you to understand is how complex health systems really are from the revenue perspective, the cost perspective, the clinical variability, and how that does align and how that does not align. But the more familiar you are with it, the more opportunities you're going to see. So, what are the opportunities? Simplifying by saying this, there's a convergence of technology, convergence of innovation, and there's demand. And there really is an unprecedented window. I think all of you can count dozens, if not hundreds, of AI applications trying to get some piece of this healthcare ecosystem. It's a competitive space, but I think that competition is focusing on a really niche area where there's a lot of things you can think about that you can add value in this whole healthcare ecosystem. So one traditionally, this goes back at least 10 years, a lot of focus and a lot of entrepreneurs getting into the whole revenue enhancement and contractual clarity with administrative process. So as we talked about before, it's more of a free market system when it comes to healthcare here in the United States. It's not supposed to government. The contracting and the processes of how payment is made are just more complex. Some of it's because it's a larger country, it's a more diverse country geographically, it's more diverse in terms of the way people are. And that does explain some of the contractual complexity, but some of it is too is this, it's just a free market. And in the free market system, there's more variability in terms of the contractual points. And the contractual complexity, contractual variability means it's much harder to solidify with AI. It can only be partially solidified with AI. And I can talk about this in part downstream also. So AI advancements and capability. I'm sure everyone's familiar with AI Doc, various technologies that come out of the United States, Israel, some of them are absolutely phenomenal. The focus on a lot of them is more on the clinical side of it. How do you increase patient output, patient outcomes? How do you make the clinician, the radiologist, the doctor, even the surgeon more effective in his or her job? There's a lot of ways that these are thinking about, but you have to imagine every single application as part of an ecosystem, not necessarily a standalone solution. That's probably one of the biggest themes I would want to get into. And I'll talk more about this when we talk about due diligence into your market, but you have to imagine everything you're doing as part of a larger ecosystem, not a standalone solution. Regulatory tailwinds. Okay, this means a lot of things here. There's a lot of legal requirements with innovation, a lot of legal requirements with IT, information security, PHI. I'm sure those of you that have tried to get patient data from United States hospitals, you've learned very quickly how I guess regulation really affects that timeline and how hospitals are very, very protective over that data. Some is just based on PHI, HIPAA, some is just based on, hey, we know this data is worth a lot of money. We're not just going to give it out for free. Investor appetite, in my opinion, there's billions invested by VCs, private equity firms in this space. They're looking for the right ideas. I've got a big network where I'm in constant discussion. They know where to look and they know how to look. But I think a lot of what you want to think about as an entrepreneur is also educating your investors. So step one, I'm sure enough of you have founded enough companies in your days, or at least in the process of founding companies these days. So if there's anything I want you to get from today's lecture is you need to deeply and thoroughly understand the problem you're attempting to solve. I think often enough, a lot of the innovations I've seen, they're very product focused, meaning you're inventing a really nice product, a nice application. I'm personally of the opinion you need to understand your market and then find the product that solves that market need. Too often I've seen a product try to fit a square peg into a round hole where the market's not exactly demanding that need. It's almost trying to augment the market a little bit to make it sure the market can align to the product. You want to avoid those sort of things because people like me in our roles are very good at identifying these issues and very good at solving these ideas. Investors similarly will be very mindful of it. So map the stakeholders. There's many stakeholders in the hospital environment. For those of you thinking about the application space, you're probably thinking about clinicians and then executives within IT. And that's correct. And you're correct to think of it that way. But you also have to think about finance people. You think about people like me in supply chain and commercial functions. You have to think about all the downstream stakeholders, or they're going to be immediately impacted and indirectly impacted by what you want to solve. So it's a huge ecosystem you want to think of. And the better you map out that ecosystem, the more successful you're going to be. due diligence into the market and impacted ecosystem, right? You might have an idea, you might have an application that will reduce nurse time by 15 minutes every 3 hours. It might be a phenomenal idea, but you have to think about all the things that are around it. What's the integration with Epic? What's the doctor's life cycle? What's the unstructured data that correlates to the structured data? It's a huge area you want to be very, very fluent in because a very fluent investor and a very fluent committee is going to know how to ask those very tough questions. Understand distribution and commercialization. For those of you thinking about medical devices, you might think about standalone devices. You might think about devices that combine with other equipment or other devices for that matter. Being able to map out that ecosystem is going to be very important because you're never going to be able to solve the problem in totality. You're only going to be thinking about solving the problem in part, at least to start. So the more you can understand around that, the better you're going to be. Pressure test your thesis and find your value proposition, right? So why is that important? I'm sure a lot of you have boards, a lot of you have network that can help you with your ideas, that can help you develop your concepts. Remember, when you get to investors and when you get to people like me on the hospital side and on the provider side, we're going to be asking a lot of those tough questions. And we've got a lot of familiarity, we've got a lot of experience going through this. We have a lot of ideas that are pitched to us and a lot of things we say no to. So we're pretty adept at getting through this. And the more prepared you are and the more thorough you are in your answers, the better of a position you're going to be. So key validation questions to answer is after you really define the above, what are the critical steps required to get your product to market? Sales cycles in hospitals are very long. They're even longer than they are in the payer world. So you have to be very mindful of all these sort of things. Designing your solution, right? So step two here. So clinical efficacy, value proposition, and adoption, right? So ground your solution in evidence. Hospitals, they're scientifically driven, they're academically driven, making sure you can actually present the evidence clinically, especially for those of you that are not clinical or don't have clinical backgrounds yourselves. You need to be sure you're partnering with clinicians and business leaders early. Investors will put a lot of pressure on your ideas and concepts, especially those that are savvy and those that actually have clinicians on their side of the fence also. Really take the time to understand healthcare sales, distribution, and commercialization. There's a lot of resources available to you that can help you do this. I think this is where entrepreneurs and founders get stuck the most. I think too much they're relying on relationships, they're relying on just shaking hands. There's a lot of things you need to think about coming together in order to be effective. Hospitals can be fantastic customers. They can also be very challenging customers. I think the better you plan this out in the future, the more success you're going to have downstream. And in net, that's the highest ROI, and that's really where your valuation is going to be driven. Interoperability, integration, this is extremely important for those of you that are thinking about software applications and general AI solutions. Never think about anything you do in AI or software as a standalone concept because remember, in net, it has to integrate. And the better you understand the integration points around it and then the business impact of the integration around it, I think the better prepared you're going to have these conversations. The due diligence life cycle. I can't say this enough. Do the research. And when you think you've done enough research, plan on doing 2 to 3x more research. You're going to find a lot of different cultural variances between hospitals. You're going to find a lot of different perspectives based on the stakeholder. My job function at a different hospital works very differently than it does where I currently work. You have to be sure you're getting a lot of diverse perspectives because there's nothing worse, in my opinion, than spending 2, 3 years of your time on the wrong idea and the wrong concept. You should almost be looking for no's as opposed to be looking for yeses to really fine tune your solutions. The more you do there and the more you refine your solution, the better you're going to be positioning yourself when you're fundraising and the better you're going to be positioning yourself when you're engaging with your customers. Know your market, know the price points, know the decision-making criteria, know what they're likely to ask you. Are they more focused on revenue? Are they more focused on cost? Are they more focused on the clinical outcome? Are they more focused on the clinical experience of the clinician, the doctor, the nurse, the surgeon? All these things require very specific answers, and you have to be very clear. There's complex contracting requirements also. I think everybody's familiar with HIPAA, everybody's familiar with PHI requirements. There's a whole host of legal requirements above and beyond that. The more you familiarize them, you're going to have legal advisors, you're going to have business advisors that maybe know legal things too, but the more prepared you are to have the conversations with people that are on the regulation side. Remember, people on the regulatory side at hospitals and providers, they're not necessarily incentivized by ROI, they're incentivized by avoiding risk. So the sooner you recognize that, the sooner you can navigate those conversations. Ultimately, know your competition, right? Are there existing solutions out there? Are there existing concepts? Are you taking a manual process and trying to make it a digital process? You have to be fluent in these conversations. I think thorough market knowledge is key for your investors. Too many founders overestimate the business case. And what I mean by that is this. we're in my world, we're very familiar with overestimation of valuations, overestimation of market data, right? Huge ROI. The ROI we see is probably a fraction of the ROI that's being presented to us too. So the more you can talk through that, the more you can have this conversation, the better position you're going to be. Go to market strategy. So there's business to business, health systems and payers. As I mentioned before, I'm much more familiar with the health system side than the payer side. You have to meet the right people. Your network will get you to the right people. You have to go to committees. You have to use LinkedIn. You have to shake hands. You have to get to know your customers. B2C, it's a very different kind of criteria because rather than selling to one of the thousands of hospitals, you're selling to potentially millions of citizens here. It's a very, very different concept, right? There's fast feedback loops, there's brand ownerships, there's lower regulatory exposure because it's maybe sold at a CVS or a pharmacy. It's my opinion, it's better for wellness, preventative health, wearables. There is an ROI, but remember that entire market is going to explode, that entire market is going to change. Citizens, average healthcare consumers, they're fickle. They change their minds. They go with different trends. There's a lot of innovations that are going to come there. And I think just be mindful of where you want to innovate and really where you want to spend your time. So step four, building a sustainable business model. I'm sure I'm speaking to many savvy business founders here. There's a software model, software as a service, subscription, user licenses, per seat, per patient, recurring fees, a lot of hybrid ways. You might contract with one hospital one way, you might contract with a hospital a very different way. You're going to have to figure that out very quickly in your life cycle. What's likely to lead to the highest revenue and the highest ROI based on your customer? Outcome-based pricing, these are a little bit tricky to navigate. And I'm sure everybody's heard about these things, either a percentage of revenue, percentage of risk avoided, you're maybe sharing the risk. What's interesting about these concepts is they work in theory. And what I mean by that is they make your customer more easily likely to say yes. They're less concerned about risk. But what's hard downstream is you have a lot of gray area in your contracts and have a lot of gray area in the data itself that make it a little bit challenging and a little bit difficult to get your head wrapped around the issue itself. So what that often leads to is contractual debate downstream. There's a lack of clarity. There's circumstances where maybe nobody's managing the solution the way you want to. You have to be a little bit mindful of these sort of things. Equipment, devices, and supplies. These are those of you who are thinking about products. You have to be mindful of the price points relative to the competition. If you're inventing a new concept, you're partially thinking about as inventing from an existing concept. You're partly thinking about building something on your own. Know your competition, know your price points. Program implementation. This is probably something a little bit more attuned to maybe some softwares, maybe more attuned to larger, what we call outsourced services, probably not so much for founders, maybe more private equity focuses, but you're essentially designing a program around total value. You're not thinking about an itemized user license. You're not thinking about an itemized price per product. It's a larger way of thinking about it. My theory, I guess my general suggestion is know your customer, know what they're likely to say yes to, and you have to be very good at mirroring what your customer is expecting to the way you're designing your price points, because ultimately that's going to maximize your revenue. Ultimately, it's going to maximize your ROI to yourself and to your investors. Step five, navigating the funding landscape. I'm sure everybody's well familiar here. We don't need to spend too much time thinking about the pre-seed levels, 50K to half a million, seed levels, 500K to 3 million, Series A, 5 million to 20, and Series B, 20 million plus. Obviously, there's a lot of variability here. There's a lot of crossover here. There's a lot of things here, but remember where you are in the life cycle is going to determine a lot of your next steps too, because I think there's nothing more I guess concerning to an investor than finding, hey, a great concept on paper, a great concept that works in a PowerPoint, but hey, the due diligence underneath it wasn't actually done as thoroughly as could be. Team six, advisors in your execution. I can't emphasize this enough. You're going to need clinical champions on your side of the fence for those of you that are actually developing clinically based solutions. Physician or healthcare leader can validate, open doors, testify to the clinical need. Non-clinical solutions are not going to require this, but they will need a right business stakeholder who can help navigate this landscape for you. For those of you that are founders, for those of you that are engineers, technical backgrounds, that's great. And obviously, you're critical of the process too. If you yourselves are not fluent in the business considerations that are required, make sure you're bringing those people on as either contractors, consultants, or finding a way to bring them into your idea here. When you have a clinical champion on your side, you want to be sure that clinical champion is in the room with the clinicians on the investing side or the clinicians that are at the customer side also too. Subject matter lead, for those of you who are thinking about anything involving electronic medical records, electronic health records, the API experience, HL7, FHIR, HIPAA architecture, these areas are extremely critical. There's many Epic architects that know the space, how to integrate solutions into Epic, how to be interoperable with other solutions. Knowing the space is critical because nothing will slow your solution down and slow your technology and adoption down faster than not having enough of that. Commercial lead, someone who's either fluent in hospitals and contractual requirements and the whole life cycle, but can really be your champion and can really be your lead for this. Commercial knowledge will be more effective than fancy pitch decks. So somebody who's savvy enough, somebody who's gone through the motions themselves, somebody maybe is from industry, very important. Regulatory advisor, regardless of how unsophisticated or sophisticated your solution is, you're going to need to have somebody who knows how to go through the FDA pathways, HIPAA requirements, licensing, and even just generally familiar with what healthcare legal terms and conditions are in the United States too, because they're different than other parts of the world. Execution principles, these are very high level. These are just ways of breaking up. Think about this, think about breaking up your concepts and your teams to making sure they align to this. But in general, this is relatively straightforward stuff that you want to think about. Commercial process, hospitals and health systems. This is where I sit. This is where I reside with my colleagues and teams that manage. So most medical device and capital equipment will go through a formal committee review. It's doctors, surgeons, it's radiologists. They'll present in new technologies they would like to consider. This is formal committees, mix of clinical people, mix of business people. Eventually, there's a downstream consequence of contracts. The decisions are weighed as a factor of cost, quality, patient outcomes, and experience with clinicians. There's no real set formula. The best solutions, in my opinion, are the solutions that increase patient outcomes and lower costs to the hospital. There are times where there's solutions that increase costs, but they come at a better patient outcome. Those are weighed very, very carefully. But there's also solutions that just, hey, they keep quality about the same or very close to the same, but they drastically reduce cost. There's many ways of thinking about innovation, but be very careful with the way you go with these conversations because the last thing you want to do is increase cost and keep quality about the same too. Those are the hardest solutions to say yes to. Software applications and AI solutions are governed by a mix of IT executives, clinicians, and business stakeholders, sometimes a business stakeholder, someone like me. Similar to medical device and equipment, these technologies will go through extensive technical review across integration, information security, HIPAA, PHI compliance, and really the total ROI across various dimensions. I say identifying the right stakeholder is key. You can find the right person through research, industry groups, networking, or standard sales processes. They can be clinician, and clinicians can be your champions. IT stakeholders can also be your champions. They can find and identify the right technologies. They can get them committee with you. They might themselves be incentivized to find the right technology. There's a finance executive, he or she might be very concerned with increasing revenue, lowering cost, or the supply chain person, such as me, who's concerned with all three increasing revenue, decreasing costs, and then increasing the quality to our patients or our staff too. So there's a lot of ways to get through this. The due diligence that I've talked about a few times today, the market knowledge that I've talked about a few times today, they're going to be critical in order to getting this right. I would say this too, communicate value early and expect your stakeholders to regularly be overwhelmed with other companies, entrepreneurs, and founders looking for their time. I can't tell you how many different messages I get on LinkedIn, how many people call my phone, call my cell phone, send me text messages, emails I get from everybody. Everybody thinks they've got a great idea. In my role, we have to differentiate what are the good ideas and what are the not good ideas, where our time is worth, where our time is not worth spending. So the sooner and the better you communicate the value and why your idea and your concept is worth the time, the better off you're going to be. So differentiation is critical. And I'm not talking about differentiation from a business school textbook with graphs and charts. I'm talking about how you actually engage and where you're going to prove your value early because you might only have 20 to 30 seconds to get it right. So it's one of my favorite sayings, the best time to solve a healthcare problem was 20 years ago. The second best time is now. I think we've all seen dramatic increases in technological advancements in AI. I think those advancements are going to far outpace the adoption because the adoption life cycle is so slow on my side. And quite honestly, considering how slow it is on my side, we're going to see even more advancements. And we know that our pace is probably going to be much slower than those technological advancements. So be very mindful of that. Where are you going to be at the end of the life cycle as opposed to where you are right now? Talk to industry. I think the best ideas will come from a mix of founders and clinical and business SMEs. As great as your idea is, talk to more people. You'll get more feedback about it. You'll get better positioning from it. Clearly and effectively communicate your idea to your stakeholders and investors. Nothing will lose confidence faster than ideas that are unfounded. Plan for multiple funding sources, near term and long term. Your approach today might be a mix of your own finances, your team's finances, those that you're close with, friends. Eventually, you're going to want to think about institutional money too. So just think about what all that looks like. And think about this. I mean, healthcare is going to change. I mean, it's an area, it's a space where there's a clinical and critical need for innovations, but just be mindful of where you're going to take this and be mindful of where you want to go in the future. So, with all that said, I certainly want to open up the floor now to anybody else. I want to talk about questions about anything related to the content, anything related to the presentation itself, or even if you want to, we can start talking about your ideas and I can immediately give feedback in terms of what I think and at a high level and some of the next steps you should take. So, certainly turn the floor back over to everybody else.
Yes, you can unmute yourself and ask the question now.
Hey, Yoni. Thank you so much for your time. I mean, it was a lot, but it was really interesting. Quick question. How would you recommend an Israeli founder to do the research, as you said, specifically when it comes to the problem space and the finding the stakeholder? Like, what's your method or for something like that?
Yes, I mean, it depends on where you're in the life cycle. I mean, if you have a concept already you're thinking about, or you're trying to look for a new concept itself.
Let's say one has a technology or a concept already, but essentially you're saying don't rush into the development, like just make sure that it's founded, right? Like make sure that you understand the setting, the environment, the decision making, etc. So I'm
Mhm.
just trying to understand how would you recommend, like let's say I'm not in the US right now.
Mhm.
I like how would I go about it, considering the fact that it's so complex and nuanced?
Yeah, sure. So just to kind of simplify it a little bit more, talking about more software AI, you're talking about more of a medical device
Software.
software. Okay, cool. So I mean, think about this, at least from the healthcare provider side. And healthcare provider side is a hospital, it's a complex health system like where I work and where I spend most of my career. There's really, let's just call it three areas of value. So one is increased revenue,
Yeah.
right? So increased revenue means more patient revenue from patients directly, more from commercial payers, government payers, or more grants. So for the most part, you're thinking about more revenue from payers and from patients, right? It's one thing. Two is lower expenses, right? So if we're thinking about decreasing our expenses, that's also a value add to our bottom line too, and it helps our operating margin. So what can I think of as excessive hospital costs or unnecessary hospital costs? And therefore, what can I use from an AI or software perspective to reduce cost? Third, let's talk about patient outcomes, right? So if we have to say, what are the general issues in patient outcomes? What are the likely problems? How can care be coordinated differently? How can a radiologist or pathologist read his or her specimen or file MRI scan better? Those are separate kind of questions too. All these things will add to a better patient experience and patient outcome, longer term health, longevity, health span. Those are all things that hospitals think about, right? It's not just revenue, it's not just cost primarily to focus on the patient outcome, right? So there is a whole host of things we can research and get into, and I'm happy to talk today. I'm happy to talk in the future what this might be about. Where can you add value using software applications there? In my personal experience, this is true for VCs and private equity. I think when they think about software, they're thinking much more about revenue enhancement. So revenue enhancement's an important theme. But remember, in the macro sense, revenue enhancement means somebody has to pay for it. So it's either a taxpayer, or it's an employer plan, or it's quite literally United or Cigna or Blue Cross. They're actually going to have to think about giving more money to a hospital. So it sounds good in the micro sense because the hospital has more cushion to their bottom line. But remember, in the larger space, someone still has to pay for it, which means you are creating a different factor downstream, maybe 1 year, 2 years, 3 years out. I think the real untapped area in hospitals and healthcare providers is just using AI to simplify work and using AI to actually make expenses lower, either by simplifying decision making or quite honestly, just reducing waste and just taking manual processes and making them more technical and software based. But there's people like me. Obviously, we're all over LinkedIn. There's IT executives, directors, senior directors, vice presidents, senior vice presidents all over LinkedIn. There's industry groups. I'm sure you're all familiar with HIMSS. I know a lot of Israeli companies like to go out there, but I think just by shaking hands and getting to know people, and then joining industry groups like this, you'll just continue to brainstorm. And listen, by the way, there's nothing wrong with using Gemini, Claude, or GPT to start getting ideas and fine tuning because they can pull from every single medical record, I'm sorry, journal, industry groups, contracting entities, and really refine your solutions.
Right. Thank you so much.
Sure. We also have questions. I'm happy to talk more high level, go back into the presentation, use specific examples. Anybody's working on a technology or concept and wants feedback, I'm happy to talk things out with them, give some next steps.
Uh, Hi. Hello. Hi. Thank you very much for the presentation. I have a short question. It's more related to a specific segment in the healthcare that I wanted to know if there is an interest or a focus on. I was specifically asking about emergency tactical, related devices that can help in the combat or in emergency situations like that.
Sure. You're
So I
talking
don't
about,
know.
yeah, yeah. Was there more? I'm sorry.
No, go ahead, please.
You're talking about like what could be used in a combat setting, like in
Yeah,
technology?
I'm wondering if there is an interest or a focus on that specifically in the recent years, given the state of the entire world. I'm wondering if there is a shift in focus towards that, or it's still in kind of in the outliers.
Yeah, it's a great question. I live in New York City, so I mean, quite honestly, there's ambulances everywhere and there's hospitals everywhere. So I think the biggest risk from a logistics perspective when it comes to emergency care, I think you think about is just traffic in New York City, right? So obviously paramedics and EMTs, they're equipped with what they need to know, but obviously getting the patient, whatever they're suffering from, to a hospital and emergency room, is probably the thing to think about. I do believe this though. Drones can, the technology exists today, and I'm sure somebody's thinking about it today. Drones can spot a field, drones can spot a combat zone. Drones can land very close to an injured soldier and then probably be used and operated by a clinician, a doctor, a paramedic in an office, hundreds of miles away, potentially 10, 20 miles away, potentially, and used to stabilize a patient. I mean, the technology does exist. Obviously, the drone technology has existed for more than 15 years, but even the surgical technology and the stabilization technology and the integration, I mean, it's there. I'm not saying it's easy. I'm not saying it's simple, but if you think about the basics of identifying where a soldier is, where a soldier might be injured, and then the stabilizing from maybe blood vessels to basic wounds to maybe even injections of medical supplies and pharmaceuticals, that is something to think about too from a technological advancement. I'm sure you're all familiar with Intuitive Surgical, makers of the Da Vinci surgical robot. That concept is interesting because typically the surgeon is in the room. And it makes sense for a surgeon to be in the room because the patient is there too. There's no reason why the surgeon can't be in the United States and the patient can be in Sweden and the doctor's performing this operation that way. Regulations and intercontinental, or obviously that's part of the equation we have to think about one day. But from a combat perspective, there's no reason why we can't think about drones doing this one day.
Thank you.
Do we have?
Anybody have anything else? Go ahead. Yeah, go ahead.
No, I wanted to ask also if anyone
Please,
else
of course.
has questions, then feel free to ask. We'll wait just a few more minutes.
Any chance to ask another question quickly? So another different segment, how do you see kind of the focus in this industry in advancing solutions based on 3D printing and by doing that kind of optimizing outcome, or do you see a hype around that, or is it just a hype, or do you see kind of a trend towards investment in that area?
Very good question. So 3D printing is interesting from a few reasons. So one, in the macro sense, let's just say medical supplies, like low complexity medical supplies. I don't know that it's ever going to be cost effective to have 3D printing compared to more industrial scale level manufacturing. I will say where 3D printing could be fine, and this is just a hypothetical. I'm not saying this is something that could be, let's just say there's a critical medical product that's on back order, it's just unavailable for whatever reason. It's in California, the surgery is in New York within 2 hours. Could, as a hypothetical, that be very valuable? You could print whatever it needs to be. I would say, yeah, if for some reason it's an emergency, but a couple things to think about. It's only going to be really applicable for low complexity products. High complexity products, I just don't know in the next few years that it's actually gonna be applicable. But two is just the intellectual property risk because in net, at the longer side of it, the manufacturer owns the IP behind the medical device. Or in a different way, maybe there's IP that makes that product proprietary to integrate to other equipment, other different kind of medical products. There's a whole ecosystem that manages. That's something that needs to be walked through. I would think one day, potentially for things that are very customizable, maybe like cement in bone implants, maybe valves used in the heart, maybe products that are highly, highly customized and that need to be customized to anatomy, that maybe 3D printing is therefore the answer for two reasons. One, I mean, you can make it there, but two, where the customization is so important to the patient that yeah, I think that that could actually be a real thing one day too. So the areas that come to mind are cardiothoracic surgery, anything involving blood vessels, the heart, valves, and then probably areas maybe spine, the vertebrate, those areas that were like implants are very specific to anatomy, I think are probably going to be part of the equation long term. One thing to think about is that 3D printing requires a machine. Obviously, it requires raw ingredients, it requires materials. There's a little tiny supply chain you want to think about also too. Space in most hospitals, especially hospitals in big cities like where I work in New York, space is a premium. It's not as if we have unlimited space for more machines, unlimited space for more robotics. So eventually, too many machines on site is going to create a separate issue too, something you need to think about. But I think in some way, yeah, I think customized printing for anatomy it is going to be a real thing. Yeah,
That's what I was focusing on. So thanks.
yeah, yeah. Yeah, do some research. Let talk to people in cardiology, cardiothoracic surgery. Look at what Medtronic's done, what Boston Scientific's done, what Abbott has done. I think just thinking about that concept differently too. But there's plenty of engineers in that space, and they're part of a lot of industry groups. I think that's a really good thing to think about.
Okay, thank you.
Okay, if we have another question, now is the time. I'll give you guys a minute.